How's your pelvic floor? A personal question, but a strong pelvic floor can help prevent a number of issues. Shannon Lapointe is the owner of Revitalize Your Health in Niagara, which specializes in improved pelvic floor health. Good morning.
Good morning. Thank you for having me.
So how can you tell, or are there signs, if there are problems with your pelvic floor?
There's several things that can happen. People often have urinary symptoms, so they're often up in the night having to void multiple times during the night, or they'll find themselves going to the bathroom frequently during the day. Sometimes they'll have leaking, both urinary leaking as well as fecal matter, which is embarrassing for many clients. Many don't know that there are treatment options available to them for this. Other people may have sexual dysfunction and sudden urgency. You could be at the mall one day doing totally fine, and all of a sudden you have to go to the bathroom so bad you're not sure you're going to make it. So there's several different things that can happen to people, and we're here to help them.
Right, and there are several different causes of this, right? Like sometimes it's childbirth, sometimes it's aging, it's menopause, and it's not just, it doesn't just happen for women, it happens for men as well.
That's right. It happens to both men and women. And the device that I use to treat this is FDA approved for both men and women. It's quite an uncomfortable thing for patients to have this happen, but pregnancy is probably the #1 reason why people have a weakness in their pelvic floor. So pregnancy, childbirth, could be heavy lifting, men who have stressful, strenuous type jobs. Several things over the span of your life can definitely weaken your pelvic floor. Menopause is another one. You lose your estrogen. It affects your bone density as well as your muscle strength. So a lot of women who do fine initially before menopause kind of go through that process, and then they can't function anymore. They're leaking a lot. It's more than they can tolerate at that point. So we see lots of post-menopausal women.
Right. You talk about a device. What is this device?
It's called the Btl Emcella Chair. So it's quite amazing. You get to keep your clothes on. It doesn't hurt. You sit there. It feels kind of strange, but it causes your pelvic floor to contract even though you're not trying to do it. So some call it the Kegel chair because it's essentially making you do Kegel exercises without even trying.
Okay, and how much is, like, you wouldn't buy one on your own. You would come in, I imagine.
Yeah, no, you definitely have to come in for treatment. It's a very expensive chair. The latest technology. It's quite expensive to buy the chair. So treatments are 6 sessions. It's a 6-session protocol. So I always see people for a free consultation first. We review their medical history, go over all the reasons why they could be having difficulty. I also make recommendations in terms of things that are contributing to their incontinence. So their alcohol intake, caffeine intake, different things like that can make it worse. So we work on strengthening the pelvic floor, but also the recommendations help a lot as well. So it's sort of a multiple team approach as well. So I work with pelvic floor physiotherapists. Sometimes people need manual treatment. So my business isn't strictly the Emcella chair. It's giving patients multiple options to strengthen their pelvic floor.
Okay, that's great. And it's really important to talk about this and to seek help. So we'll get the information up on our website at chch.com. Shannon, thank you for joining us today.
Thank you.